Now, what causes the Cushing syndrome, or what is the basic pathology behind this particular disease? Now, when basically we are dealing with a patient who is suffering from increased levels of glucocorticoids circulating in the blood, and that is basically resulting in a particular set of signs and symptoms that the patient is having. So, we are going to get into the detail of this hypothalamic pituitary adrenal axis that a normal individual has, and which is basically the normal physiology that the patient is having. So the hypothalamus is releasing certain hormones, which is basically activating the anterior pituitary gland, and that is in turn releasing the adrenocorticoid releasing hormone, which in turn is influencing the adrenal gland. So maintaining this axis is the basic thing, and whenever there is any problem or whenever there is any pathology anywhere in the axis at the level of the hypothalamus, or the pituitary gland, or even it can be the adrenal gland. Whatever the level is, it is going to have the different set of signs and symptoms, although it is going to result in Cushing syndrome, but the clinical features, the clinical picture would be quite different in these particular cases. So basically, knowing this hypothalamo-pituitary adrenal axis and how is it maintained in a normal individual, and what can be the pathologies which can result in this particular imbalancing of this axis, that is going to be discussed over here. So Cushing syndrome, we can have different sorts of Cushing syndrome. For instance, we can have the iatrogenic hypercortisolism, which is basically the drug-induced increased levels of cortisol in an individual. So a lot of patients show hypersensitivity to a lot of drugs, and the adrenal cortex comes into action and basically results in the increased levels of the cortisol hormones. Then we have the ectopic tumors, which result in the secretion of the ACTH production. So as you are just looking at the factors, that we have different causative factors. So whenever we have definitively diagnosed a patient to be suffering from Cushing syndrome, it's very important that we go one step further and identify the underlying cause which is resulting in the increased levels of the cortisol in the individual. So you'd be focusing on the fact whether it is the drugs that is causing this particular reaction, or whether we are dealing with an ectopic tumor which is resulting in the secretion of the ACTH. So even the management would be entirely different and would depend upon the causative factor. If it's a tumor, obviously we'd go for the resection of the tumor, we'd opt for the radiation of the tumorous part of the body, which is basically secreting the ACTH. So that is basically how the management even differs in different cases of Cushing syndrome. Then we have the cortisol producing adrenal adenomas, and that is sometimes, and that is mostly the case, that the adrenal adenomas are basically resulting in the secretion of the cortisol, and that is released in the bloodstream. Then we have the adrenal carcinomas, and basically we can have benign tumors, we can have the carcinogenic tumors, we can have the metastatic tumors. Whatever the case is, basically we are trying to definitively diagnose these particular cases, and then obviously move on with a particular set of treatment guidelines in these particular patients. Adrenal hyperplasia is one of the key factors that sometimes the patient are suffering from, and that is again one of the key features that the patient is suffering from. Again, release of the cortisol, again a rise of the cortisol in the bloodstream levels, and then resulting in the particular set of signs and symptoms in the individual. Now, discussing the pathogenesis, first of all, this is what I was talking about. It was basically the hypothalamus is releasing the cortisol releasing hormone, and that is basically acting upon the anterior pituitary and causing it to release the adrenocorticotrophic hormone, which is again in turn acting on the adrenal gland. and that is basically producing the cortisol. And the production of this cortisol, these blue arrows are basically indicative of the negative feedback that the cortisol is going to have on the pituitary as well as on the hypothalamus. For instance, we have the factors such as circadian rhythm or the stress, which is affecting the hypothalamus. The activity of the hypothalamus is controlled by stress. A lot of factors are responsible for this particular phenomena: arcuate nucleus, emotional stresses. They are basically responsible for the functionality of the hypothalamus to be basically deprived of in these particular cases. Then obviously we move on to this particular phenomenon of pituitary gland, and whenever we have the pituitary gland adenomas, they are sometimes responsible for the secretion of increased levels of the ACTH in the blood, and subsequently they result in the adrenal gland to be affected, and obviously then we have the increased levels of the cortisol secreted. And although there is a negative feedback that is even evidently present in these patients, but due to the fact that they are suffering from particular stressful conditions or particular adenomatous conditions, there is going to be a continued release of the CRH and the ACTH hormones in the blood levels. What happens to this axis in Cushing's disease, as we can see, there is an increased levels of the ACTH hormones, and that is subsequently affecting the adrenal gland over here. So it can be a pituitary adenoma that is secreting the ACTH, although there are normal levels of the CRH secretion. And whenever we basically conduct a 24-hour test for CRH or ACTH, that is going to reveal the levels of the CRH and ACTH for the comparative study, and making it easier for a physician to diagnose that this patient is suffering from pituitary adenoma. And obviously, along with the blood tests, we're going to couple the blood tests with the radiographic imaging techniques, for instance, CT scans and MRIs, which can indicate the presence of the pituitary adenoma in an individual. So this is the basic pathogenesis that is related to this particular Cushing's syndrome. We have two different varieties when we are dealing with Cushing syndrome. First of all, we have the ACTH dependent Cushing syndrome. First of all, the hypothalamus is over here is secreting the CRH, and that is acting upon the anterior pituitary gland. The corticotroph adenomas, they secrete the ACTH and causes the adrenal hyperplasia. So this is the basic pathology over here in the case of ACTH-dependent Cushing syndrome. The adrenal cortex hyperplasia is basically pursued in these cases due to the stimulation of constant ACTH production, and there is an increase in the ACTH hormone in the blood levels. So the ectopic tumors can sometimes be responsible for the production of the ACTH. It's not always the case that the pituitary adenomas are secreting the ACTH. In some cases, we have the ectopic tumors that are secreting the ACTH and causing the adrenal hyperplasias in the individual. So again, whether it is being secreted by the pituitary adenomas or whether it is the ectopic tumors, it is going to act upon the adrenal cortex and is going to cause the hyperplasia of the adrenal cortex. The negative feedback of the cortisol is present in these patients, and it basically causes the suppression of the hypothalamic CRH and the pituitary ACTH secretion for these patients. Then we have another variety, which is the ACTH-independent Cushing syndrome. Over here, what happens, or what is the basic pathology, is that hypothalamus basically secretes the CRH and is acting upon the anterior pituitary in a normal way. And then a normal ACTH production is seen in these patients. There is no ectopic or there is no pituitary increase in the ACTH secretion. The adrenal cortex hyperplasia due to the stimulation of the ACTH secretion occurs. And why does it happen? It happens due to the adrenal adenomas itself. So over here, the basic pathology in comparison with the previous group in which we discussed that the ACTH was being produced by the ectopic tumors. Over here, we have the adrenal adenomas, and that is basically secreting the cortisol autonomously without the ACTH being involved over here. So that is why this is known as the ACTH independent Cushing's syndrome. Again, a negative feedback is present and there is suppression of the hypothalamic CRH, pituitary ACTH, causing the adrenal atrophy. So even when you'd be conducting the tests and you'd be noting down the levels of the CRH and the ACTH in these patients, they would be quite normal. In fact, they would be below normal due to the negative feedback that is present. And the hypothalamus is acting in a normal way. The anterior pituitary has no pathologies. We are dealing with a specific pathology that is only affecting the adrenal adenomas over here. So over here, we basically got to know the fact that there is a hypothalamo-pituitary adrenal axis that has to be maintained. And at any level, there can be a pathology, and basically we are dividing the Cushing syndrome into two major groups due to the pathologies that are involved at the back of this particular Cushing syndrome. It can be an ACTH dependent Cushing syndrome where the pathology is lying in the pituitary gland or the hypothalamus is involved in this particular case. And on the other hand, it can be an ACTH independent Cushing syndrome where the adrenals are involved primarily. So you have to basically focus on and dig out the underlying cause or the underlying pathology accordingly in a particular patient.